Imagine a disease so deadly it killed more people in 18 months than World War I did in 4 years. A pandemic that infected 1/3 of the world's population and changed human history forever. This is the story of the 1918 Spanish flu, the deadliest pandemic in recorded history. Despite its name, it didn't start in Spain. And it wasn't just a flu. What made this virus so uniquely terrifying, and what lessons does it hold for our modern world? Make sure to hit that subscribe button. We're diving deep into one of history's most crucial yet forgotten disasters. Origins and outbreak. The Spanish flu got its name for all the wrong reasons. During World War I, most countries censored news about the pandemic to maintain wartime morale. But neutral Spain reported freely on the outbreak, making it seem like Spain was hit hardest. Most experts believe it actually started in military camps. The first recorded case was at Camp Funston in Kansas on March 11, 1918. Within days, over 500 soldiers were sick. From there, American troops carried the virus across the Atlantic to Europe. The cramped conditions on transport ships and in military camps created perfect breeding grounds for the disease. By spring 1918, the flu had spread across Europe, but this first wave seemed relatively mild. Many thought the worst was over. They were tragically wrong. The deadly second wave. In August 1918, the virus returned with a vengeance. This second wave was a monster, a mutated strain that was far more deadly than anything seen before. What made this flu different? It was an H1N1 strain that triggered what doctors called a cytokine storm. The body's immune system would overreact and attack itself. Most seasonal flus kill the very young and very old. But Spanish flu had a horrifying twist. It targeted healthy adults aged 20 to 40. The stronger your immune system, the more likely you were to die. Hospitals were overwhelmed. In Philadelphia, bodies piled up in morgues and on sidewalks. The city ran out of coffins, and mass graves were dug with steam shovels. People turned blue before they died, a condition called heliotrope cyanosis caused by lack of oxygen. Victims could be healthy in the morning and dead by nightfall. Global spread and impact. The pandemic spread with terrifying speed. Ships and railways carried it to every corner of the globe. Remote Pacific islands that had been untouched by outside diseases for centuries were devastated. In Western Samoa, 22% of the population died. In Alaska, entire Inuit villages were wiped out. Some communities lost 90% of their people in just weeks. India suffered the highest death toll, an estimated 17 million people died. Entire regions were left without enough people to harvest crops or maintain basic services. In colonial Africa, the death toll was catastrophic but poorly recorded. Some estimates suggest 2 to 3% of the entire continent's population perished. Even China, which had remained relatively isolated, couldn't escape. Major cities like Beijing and Shanghai saw massive casualties. Social and economic collapse. Society began to break down. Businesses, schools, and churches closed. In many cities, it became illegal to gather in groups. Basic services collapsed. There weren't enough grave diggers to bury the dead. In some places, bodies were left in homes for days because there was no one to collect them. Cities imposed mask mandates and social distancing rules that sound familiar today. San Francisco required masks in public. Violators faced fines or jail time. But just like today, there was resistance. The Anti-Mask League formed in San Francisco, arguing that masks violated their constitutional rights. The economic impact was staggering. Global GDP fell by 6%, businesses went bankrupt, and millions lost their jobs. The pandemic accelerated the end of World War I as armies became too sick to fight. Medical response and treatments. Medicine in 1918 was primitive by today's standards. Doctors had no understanding of viruses. The flu virus wouldn't be identified until 1933. The main treatment was massive doses of aspirin, sometimes 30 grams per day. This likely killed many patients through aspirin poisoning and internal bleeding. Desperate people tried everything: bloodletting, mercury treatments, even drinking their own urine. Quack cures were everywhere, from electric belts to cocaine-laced remedies. The real heroes were nurses and volunteers who provided basic care. Good nursing, keeping patients hydrated and comfortable, was often the difference between life and death. Scientists worked frantically to understand the disease. They knew it spread through the air but didn't understand how viruses worked. Cultural and psychological impact. The pandemic left deep psychological scars. Entire communities were traumatized. Children grew up having lost parents, siblings, friends. Faith was both tested and strengthened. Some saw it as God's punishment, others as a test of faith. Religious leaders struggled to provide comfort while keeping their congregations safe. With so many men dead or sick, women entered the workforce in unprecedented numbers. The pandemic accelerated social changes that were already underway. Artists and writers tried to capture the horror. The pandemic influenced the dark, existential mood of the 1920s, the sense that civilization was fragile and life was precious. The third wave and end. A third wave hit in early 1919, but it was much milder. The virus had burned through the most vulnerable populations and was beginning to mutate into less deadly forms. By summer 1919, the pandemic was essentially over. Life slowly returned to normal, but the world had changed forever. Strangely, there was little commemoration. World War I overshadowed the pandemic in public memory, even though the flu killed far more people. The final death toll? At least 50 million people worldwide, possibly as many as 100 million. To put that in perspective, that's more people than live in most countries today. Lessons and legacy. What can we learn from 1918? First, that pandemics are inevitable and can strike without warning. The Spanish flu showed how quickly modern transportation can spread disease globally. The social responses look familiar: mask mandates, social distancing, business closures, and public resistance. Human nature hasn't changed much in 100 years. But our medical capabilities have transformed. We now understand viruses, have vaccines, antiviral drugs, and ventilators. What took months to identify in 1918 now takes days. We've built global surveillance systems to track emerging diseases. The World Health Organization exists largely because of lessons learned from 1918. Scientists have even recreated the 1918 virus in labs to understand exactly what made it so deadly. This research helps us prepare for future pandemics. Conclusion. The 1918 Spanish flu pandemic was a turning point in human history. It showed us how vulnerable we are to emerging diseases, but also how resilient human society can be. Today, we're better prepared than our ancestors were in 1918, but we're not invulnerable. The COVID-19 pandemic reminded us that infectious diseases remain one of humanity's greatest threats. What surprised you most about the Spanish flu? How do you think we should prepare for future pandemics? Let me know in the comments below. If you found this video informative, check out our series on other historical pandemics. Don't forget to like, subscribe, and ring that notification bell. Until next time, stay curious about history.